This is about a 55-year-old man with history of heart attack diagnosed 1 year back in our hospital. But after that there was no follow-up because he had been managed by alternative medicine. He presented here with worsening symptoms for the past few weeks, so again readmitted in our hospital. Our cardiologist advised CT scan with IV contrast after the odd findings in the ECG and echo. With the given images, please give the findings, the differential diagnosis and the final diagnosis. And please mention about the differences between the two types. If you want more time, please pause the video and reassess the given images. Now I will discuss about the findings and the diagnosis. Are you ready? Let's go. Topogram and plain CT chest reveal mild degree of right pleural effusion. There is significant cardiomegaly. The left ventricular contour appears squared off with well-defined bulge. On CT chest, there is large contrast-filled dilatation of left ventricle from the posterolateral aspect with a narrow neck. There is no calcific or thrombotic or embolic foci in the given images. There is no well-defined myocardial wall around the bulge. Now we will go for the differential diagnosis. The first one is true ventricular aneurysm. The second one is false ventricular aneurysm, which is otherwise called as pseudoaneurysm. The third one is ventricular diverticulum. This ventricular diverticulum usually is detected in the fetuses and very commonly seen in newborns or in infants up to early childhood. Diverticulum is very rare to have presentation in the adulthood. Now we'll go to the final diagnosis. The final diagnosis is left ventricular false aneurysm, which is also called as pseudoaneurysm. We will discuss about the differences between the true and false ventricular aneurysm. True ventricular aneurysm is more common than pseudoaneurysm, which is almost 9:1. If any true aneurysm, in any true aneurysm, there will be three layers which will be showing intima, media and muscular layers, which could be thinned out actually and can be seen pathologically. But the pseudoaneurysm is due to focal contained rupture with aneurysmal dilatation where there will be no well-defined wall but can be covered by the pericardial wall. X-ray chest, when you go for X-ray chest, it shows thin calcific rim in the left cardiac silhouette in the true ventricular aneurysm, and that cannot be there in the false aneurysm. But the pseudoaneurysm might have double hot border in the left cardiac silhouette in the X-ray chest. Both the types could be due to either myocardial infarction or trauma, but most commonly I will say myocardial infarction is much more common than trauma in both the types of aneurysm, and very rare to have congenital true aneurysm. And the same thing, the DD can be due to diverticulum, the same thing, true aneurysm or diverticulum. The opening of the aneurysm is wider and is called as broad-mouthed true aneurysm, whereas if the opening of the aneurysm is narrow with narrow neck, it is called as pseudoaneurysm. True aneurysm is called usually from the anterior or apical wall, whereas the pseudoaneurysm is usually from posterior or posterolateral aspect. Thin wall might be noted in the true aneurysm but not in the pseudoaneurysm. True aneurysm shows minimal or no movement on echo, whereas dyskinetic movement might be noted in the pseudoaneurysm. True aneurysm gives paradoxical expansion and filling, whereas delayed filling after contrast might be detected in the pseudoaneurysm, as in this case. Risk of rupture is less in the true aneurysm, and because it's already calcified, so it might have calcified wall, so the risk of rupture is very much less, whereas there is higher risk of rupture in the pseudoaneurysm because it is uncalcified. True aneurysm is usually managed by medical management, and if the wall is uncalcified, then it has got a high risk and you might go for surgical management. But pseudoaneurysm is usually uncalcified and is having high risk for rupture, and so surgical intervention is needed. This quiz has been given as a quiz few days back. I salute all of those who have participated in the quiz. Dr. Madhumita, Dr. Kader Baksh and Dr. Raghavi are the superstars who have given the perfect answer. Dr. Paresh is the near superstar, and Dr. Chetan Vaishnav and Dr. Jai Chandrabose are the shining stars of the quiz. Dr. Shruti and Dr. Shripra Agarwal are the singing stars of this quiz. I congratulate all of them and everyone. At last, I thank you very much to all the viewers for watching this quiz video. Please do not forget to like and share this video. Also, please subscribe to the channel for the updates. Your comments are very much welcome. Thanks a lot again. Bye bye and take care.